Eastern Cape Health Department spokesperson Siyanda Manana joins us now for more. Thank you very much, Mr. Manana, for your time this evening. We hope we can clarify some of the confusion. Can you tell us, first of all, we heard from parents what they said about what had been revealed to them in the meeting with health officials, but we'd like to hear directly from you. How did these 21 young people die? What was the official cause of death given to their parents?
Good evening, and good evening to all the viewers. We did communicate with the parents of the eNCA tragedy. It becomes difficult on our part to communicate the cause of death to the public, because we are restricted by the Protection of Personal Information Act. We then, decided that because the document is written confidential, it becomes then necessary on our part not to then give it to the parents, but rather to share the contents of the document, which is now the cause of death. We met the parents, all of them, one-on-one, and communicated the cause of death to each and every one of them. So we unfortunately could not do so because we are restricted in terms of the law. The parents are at liberty to communicate what is the cause. However, we as government officials, we are restricted by law not to actually act outside of the law. So that is really why we cannot share with the public. We respect the privacy of the parents, and remember, we also have to respect the dignity of the children that had died. So that is why we could not go out and inform the public as to the reason why what is the cause of death.
Completely understandable. However, we have now heard from the parents. They have communicated with eNCA. We've done several interviews with them, and I'm sure you'll understand that this story is very much in the public space and has a bearing on community safety and public interest. Are you now, subsequent to already having spoken to the parents, are you in a position now to communicate directly with us about the cause of death?
No, I can, as I've said previously, we are constrained by the law not to do so. The parents are at liberty to communicate the cause of death, but we can't do that as government officials. So unfortunately, I cannot divulge that. But
are you able to tell us whether all 21 victims had the same cause of death?
Yes, I can communicate. I can confirm that. Yes. Yeah.
So there's a lot of confusion, and it's bound to cause public uproar, because so many people saw the initial news reports. So many people were struck by the nature of this tragedy. The 21 young people lost their lives in such a tragic and inexplicable way. So these investigations have been followed very closely by the public, and I'm sure you'll understand that our viewers will want a little bit of clarification. So while we respect that there are bounds to what you can share with us and what you can't, I would like to ask whether you can offer any type of clarification on the disparities between what we initially heard was that there was methanol found in those initial toxicology reports. There was communication with the parents around the possibility of poisoning, and that communication stretched as far as the media. There was even a media briefing where Police Minister Becky Cele was involved and very firmly stated they are looking into poisoning. Now we hear reports that this was suffocation. Where does that confusion and the change come from?
What I can share with the public is that when we determined the cause of death, we looked at the CCTV or the video coverage. We also look at the post-mortem findings. We also looked at the blood alcohol levels as well as the methanol levels. We looked at the screens for drugs, for pesticides, and for volatiles. We also looked at all matters that pertain to natural deaths. We considered those. And all the relevant clinical data that came from the survivors admitted in hospital, we reviewed those. So we had a fine comb as the Department of Health in terms of our investigations. We looked at the toxicology reports, we looked at the chemical tests, we looked at also the methanol, results. And I can confirm, yes, there was methanol. However, it was not to the extent that it could cause death. So the constraint that I'm having is that the parents were the ones that said we must really not communicate these issues because of death to the public. So if they have done so, we've actually, as government, respected that, because we felt that we need to dignify the process by allowing the parents to take the forefront in terms of communicating what was the cause of death of their children.
Absolutely understandable, and thank you very much as well. Understandably, that this time is most difficult for the parents. While the story is in public interest, we have to respect their dignity. However, some of those parents had questions that they shared with our reporter at the scene in the Eastern Cape after the briefing with the Health Department today. And one of those questions was around the possibility of suffocation when someone had, for instance, jumped out of a window and was no longer in the overcrowded area. We also saw on the footage that eNCA took on the morning of that incident that some of the victims were being treated outside on the lawn by paramedics, and that they still passed away. How is it possible that in those cases suffocation could be the cause of death? Is that possible?
I wouldn't want to venture into the possibilities. Safe to say that we are definite, because we gave the parents the explanation in terms of what was the cause of death of their kids. So to venture now into what might have been the cause, right now I think the parents have the right to speak in terms of what we said to them. But with us, we can't. It's extremely difficult for us to do so, because we'd really be breaking the law, and we do not want to do that.
I understand. I'm not going to press you on that any further. I do want to ask your response to the fact that some of the parents have said they're not satisfied with the explanation, that they are threatening legal action. What is the Eastern Cape Health Department's response to that?
The parents have a right, to review the findings. It's within their right. So if, for an example, review, they can do so. There's nothing really that constrains them in not doing so.
Well, thank you very much. Even though we have not been able to get much clarification from you, we do appreciate that you are bound by certain laws. That was Eastern Cape Health Department spokesperson Siyanda Manana on the death of 21 people at the eNCA Tavern Tragedy.